Good afternoon, and we come to one more session of IJCCM Best Article. So, Dr. Rubina, your article on dehumanizing effects of ICU care. What interested you in this, and what brought you to this topic?
Good afternoon, everyone. We all know that the patients who are shifted to ICU are critically ill and they have multiple problems. So, the main focus of the physician or the healthcare worker, we can say, goes towards treating the primary disease of the patients. And somehow, we felt that during this, the healthcare workers may fail to acknowledge the patient as an individual like themselves who has his own likes and dislikes and currently is now in a very, very vulnerable state. So, thinking from a patient's perspective, how he would be feeling, he has an endotracheal tube in mouth, sometimes they are physically restrained, they are semi conscious under the effect of sedation, discussions are going around them, he'll get better, he will not get better, then staff comes. IV line is started without informing. A resident comes, IVC is being done. It is being done multiple times a day. So these patients are undergoing through a lot of physical and emotional trauma and pain. Moreover, the relatives, because we have an open visitation policy in ICU, we do see them uh, regularly on a daily basis, and we do feel and understand what they are going through. So I think these are the factors. These played an influential role in us planning that study. That we should know how these behaviors or what they think of.
Okay, Dr. Binila, you can take over from there.
Good afternoon, Rubina. Good afternoon, Dr. Banani, and to all those who are watching online. First of all, Rubina, congratulations on your article, which is, I think, a very important topic and relevant in this time where we all talk about personalized medicine and personalized care and personalized intensive care. I think this is another aspect of personalized ICU care, where we're actually focusing on caring for the patient. So thank you so much for this article. I think I'd like to ask you one question. Doing such a study is definitely not easy in an ICU setting. What were the challenges that you and your team faced when you were doing this study?
So the main challenge was data collection, of course, because it is time consuming, it requires manpower, and the raw data, the interviews which are collected, the raw data is huge, so it needs to be sorted out. And for us, the data collection was done by a psychology student who's not involved in patient care, and the interviews were transcribed by two intensivists and a senior clinical psychologist as well. The second challenge probably would be that because the patients are and the relatives are from rural background, they may not want to open up freely, especially about the dehumanizing behavior, thinking that it might hamper their patient's care, although it won't in some way or the other. So that also is the factor which needs to be overcome during these interviews.
Yeah, definitely, Rubina, that is a very big challenge that I'm sure patients, their families may feel a little restricted, thinking that if they say something negative, it may actually affect the care which is delivered. Could you just briefly tell us what the key findings in your study? What were the key findings in your study?
We interviewed 40 respondents. 13 of them were patients and 27 family members. From the opinions and their interviews, what their opinions were, we classified their experiences into two dimensions. That is the experiences related to humanization and dehumanization. Four themes emerged from the data related to communication, infrastructure, experiences of care, and patient autonomy. So and there was further 8 sub themes after that. So in communication, the patients and the relatives, they felt that when the healthcare workers introduced themselves, took their name, looked into their eyes while talking, and they engaged in open and honest communication. They felt that they took that as a humanizing behavior, and they felt respected and being involved in patient care. The relatives felt that. Whereas when some of them reported that when we use medical terms or technical words. So they took that as a depersonalized behavior from the part on the part of healthcare workers. Now coming to the second theme of experiences of care, the it had three sub themes further. That was physical care, care plan, and emotional care. The I would like to summarize as when they're cared for gently, in a gentle way, like turning the patient, shifting the patient on trolleys. So these things also matter a lot. They to the relatives as well as the patient. How you communicate, the body language, whether you are looking into their eyes. So these were the factors. Once the relatives are depressed, whether you are supporting them emotionally, you are consoling them. So these were the factors which were taken into consideration, whether they reported it as a humanizing or a dehumanizing behavior on our part. Now, infrastructure wise, because we have an open visitation policy, so that relieves a lot of, as we have done a previous study also, that the families and patients, they prefer open visitation policy because they say that it relieves their stress, they can see their patients, so they took it as a humanizing experience. And because their patients are sick, sometimes we have to send them to pharmacy. They in initial few days they don't know the ways. They have sometimes they are from rural areas, they may not understand the terms in the pharmacy, they have to navigate their way back. So this added to their stress according to them, and they reported it as a dehumanizing behavior. Coming to the fourth theme of patient autonomy, the once when we inform the patient before exposing the patient, drawing the curtain, these plus informing before the procedure. So these were the humanizing behaviors, humanizing experiences they reported, as that they were informed before the procedure is going to be performed. Some said that they were not informed, so they took it as a dehumanizing or depersonalizing experience.
Thanks,
You have
Rubina.
reviewed a lot of the literature, Binila, so you want to add something more because I saw your editorial and it was very extensively you have reviewed this.
Yeah, I think, like what interests me about the topic is, I think the perspectives, we sometimes focus on just the patients and the families, but there's a lot of importance that we need to give to the healthcare workers also. I think so this triad is a very important triad to focus on when we talk about humanization, or medical humanization is what the technical term is. And I think what I found interesting is across the world, there are moves to humanizing patient care by incorporating suggestions to incorporate, this into the bundle of care at the patient bedside, at maybe ICU diaries, I think, which has been studied.
Many articles have
Yeah,
been
there's
there.
several articles on
Mhm.
that. Even from India, I think there are a few articles which have actually looked at that. But these are all things which we are not routinely doing in the ICU, but which are things which need to be done. With regards to open visitation policy in India, it sometimes has its positives and its negatives. It can be very challenging when we do not have that kind of infrastructure to support open visitation policy, where they're only going and seeing their patient. They may be coming in when there's something else happening to other patients around, which can be very challenging for the healthcare workers. I think you have addressed this in a previous article which you had put in, where there's an added stress to the healthcare workers with the open visitation
Definitely
policy.
is. That's what we
Um,
face on a daily basis also. Because
yes,
everything
yes.
is visible. Even if it is the patients are sick, they themselves also are stressed out.
Yeah.
So that's different.
Yeah, and I also felt that I think this is an area which needs to be explored further. We really need to look at it on a wider scale, from the private hospital front, from the general hospitals, government hospitals, different economic backgrounds, to understand different perspectives. It won't be the same as the Western perspective, and hence we really need to find what our baseline is, what are the obstacles that we face, so that we can, address each challenge. I would say it's like a quality improvement measure in each institution to kind of set the bar higher to make sure that we're delivering good patient care. So I think this definitely warrants more research across different hospital setups. I just have a question for Rubina.
Yeah. Go ahead.
Rubina, other than you mentioned about the open visitation policy that you have in the ICU and some other measures, are there any other measures in place that you have to, humanize the environment in the ICU? Any other measures that you have?
So patients are there for a longer period of time, tracheostomies. We do ask the relatives to get them books or put earphones so that they can listen to music or read to them what is happening, read a newspaper, what is happening around, or put that patient maybe near a window. We have some corner beds. So because they prolonged stay, they become delirious. So these are the things which we or maybe we ask them to take on a wheelchair outside so that mobilize them, physiotherapy, rehabilitation. So these things they definitely would help and
One
do
thing
help.
one thing which we found very interesting in COVID times, where families did not have access to patients, was putting their photographs of families around the bed. And
Yeah.
I think patients remember that, families remember that, they value that a lot because they felt like we were trying to maintain the connect between the patient and the family member. So I think for me, when I think about this topic, I think there's still a lot more which needs to be studied in our setting. And this is a very, very important aspect to personalizing patient care. Dr. Banani, do you have any thoughts or anything to
Yeah,
add?
in pediatric ICUs overseas, it is routinely done, having photographs of parents, pets, their own toys, and the nurses regularly make certificates. If the patient has gone for a CT scan and come back, even if the patient is completely unconscious, they'll put a certificate that so and so was very brave during the transport. Or if they've gone for a surgery and come back, they do it. So they do try to make an atmosphere. We don't do it. I agree, we don't do it. We
I think
don't.
these are all
I think
interesting ways. Yeah. It's
we
simple
have to
and it
wind
helps.
up. So I'll
Yes.
ask each of you to give a last take-home message kind of a thing. So Dr. Rubina first and then Dr.
I guess as Dr. Binila already mentioned, there's still a lot more to do. We can just when we go by the bedside during the rounds, introduce yourself, call the patients by name, look at the patient, then acknowledge the relatives. These are very, very small gestures, which, although we are overworked, we have a lot of workload, sometimes we are tired, but I think just a small gesture, talking to the patient, you're getting better, surgery has been done, because the patient is shifted unconscious from the ICU. He doesn't know where he is. He suddenly gets up bucking on the tube, and then he's restrained. So just telling them the surgery is done, you're getting better, things are getting better, talking to the patient's relatives. These aspects, these are small things which would help. Plus, incorporating the training in the training the, curriculum of the residents, the communication and empathetic care. I think that is very important, because during our training also we do learn medicine, a lot of medicine, but this aspect, I think once you become spend more years in the field, you realize more these small things.
Dr. Binila.
Yeah, I think I would just like to sum up by saying that the current need of the hour is to understand where we are and the obstacles that we have in our country to humanizing care. Thank you so much.
Thank you. Thank you both of you.